Acne is a famous skin condition that affects numerous people. It rises when the hair follicles are clogged with the oil of skin, the sebum, and dead skin cells, and ultimately leads to pimples. It is not a life-threatening condition, but it can cause emotional distress, which forms skin scary. Let us explore this video to understand the causes and symptoms and the treatment of an individual experiencing this type of skin infection. What is meant by acne? It's the most common condition of skin in which hair follicles beneath the skin clog and lead to pimples. Two factors are considered in this condition: sebum and dead skin. Sebum is an oil which protects the skin from becoming dry. Dead skin is another factor which freshens the skin by removing dead skin. However, when sebum is produced more and dead skin also fills up the pores, pimples or lesions appear, known as acne. Usually, it happens on the face, but it can occur on the surface of the whole body. How does acne appear? It's an inflammation of the skin. The skin has a sebaceous gland, which is connected to hair follicles, which have hair. In healthy skin, this gland produces sebum on the skin's surface, which is embedded into the skin's pores. Pores are the openings connected to the skin. The follicles are lined up by skin cells known as keratinocytes. When dead skin is shed, these keratinocytes appear on the surface of healthy skin. In the case of acne, the sebum, keratinocytes, and hairs are stuck in the pores, which means that the keratinocytes are not shredded, and the sebum does not reach the skin surface. As a result, this mixture of sebum and cells allows bacteria to grow, which is stuck in the follicles and causes inflammation, ultimately leading to swelling in the skin and causing pain, heat and redness at that point. A stage reaches where the follicle wall breaks down and spreads bacteria, dead skin cells, and oil to the nearest skin, which produces pimples there. Types of acne. Acne can cause various types of pimples on the skin. Acne types may include fungal acne, a type of acne in which the yeast builds up in hair follicles. These would be dry and swollen. Cystic acne. In this case, deep-rooted pimples and nodules are formed, which are usually pus-filled and cause scars on the skin. Nodular acne. It's a severe state of acne. Pimples are formed on the skin, and lumps are formed under the skin. These pimples are usually dense and can cause severe pain. Cystic and nodule acne can even cause permanent skin damage. It is from scars on the skin. Causes of acne. The causes that researchers believe can cause acne may include: when more oil is produced in the skin's pores, the pores may clog with sebum. Dead skin cells, not removed from the skin. Bacterial growth occurs in the skin. When the pores of the skin clog, some substances dump in the hair follicle and could lead to pimples, due to which inflammation occurs there, and the skin becomes red around the pimple, ultimately leading to pain and swelling. Risk factor of acne. Here are the following factors that can increase the risk of getting acne. Hormones. A male sex hormone that is known as androgen. Its increasing rate can cause acne. This is enhanced in males and females because the sebaceous gland enlarges and forms excessive sebum at puberty. Sebum is an oily substance that forms a protective layer as a barrier for your skin. The hormones that change during pregnancy may also cause acne. Family history. If your parents have had acne, there might be more chance of getting it for you. Medical history. If someone is taking medicines, especially those which contain corticosteroids or lithium, it can cause severe acne. Age. Age is a specific factor included in acne. If you are a teenager, you have more chance of being influenced by it, because in teenagers, hormones develop. Here are some points that may not cause acne, but make it worse. Stress is the leading factor that triggers acne, as in which cortisol hormone is produced. Hardly scrubbing the skin. Wear tight clothes or helmets and other similar precautions. High humidity or environmental pollution can cause this infection. Some types of food can also trigger acne, including sugar, skim milk, and whey protein. Acne can be worse due to oily product usage like lotions or creams. Picking the acne. What are the symptoms of acne? Symptoms of acne on the skin may include pus-filled pimples, small bumps formed whose color is usually red to purple or darker than the natural skin tone. Pores are filled with black tops, commonly called blackheads. Plugged pores with white pores, known as whiteheads. Lumps also form beneath the skin, which causes stiffness and pain. Sometimes, these lumps are fluid-filled and known as cysts. Symptoms of acne depend upon the state of acne. In mild cases, some pimples appear, and in the case of moderate acne, papules with inflammation occur. Severe acne may form nodules and cysts. How is acne diagnosed? The healthcare provider diagnoses acne by skin examination. To know about the symptoms, the dermatologist looks briefly at your skin. He may take a questionnaire regarding factors like stress, family history, medicines, and menstruation, and he may take some tests. If someone's acne is stubborn and cannot improve with treatment, the dermatologist will help. Describe the treatment procedure used to treat acne. Firstly, acne goes away by itself. But if someone's acne is not cleared over time, he must visit a dermatologist. He will help control acne and avoid scarring the skin and less noticeable scars. Remember one thing, if someone is using drugs for acne, acne will not be set up within days or weeks. It may take several months or even a year. Treatment depends upon the age of the infectious person, the severity of acne, and his willingness to commit it. Keep in mind that pregnant ladies have limited treatment to cure acne due to the risk of side effects. How can acne be prevented? Acne could not be prevented entirely, especially at puberty, and in the case of pregnancy, as, at that time, hormones were changed. But you can adopt some habits like wash your hands and face repeatedly with warm water. Use an oil-free moisturizer. Use makeup remover at night. Take control of keeping the hand away from the face. What are the complications associated with acne? Those people whose skin is darker in shade have a higher chance of acne and its complications than people with lighter skin type. The complications may include scars on the skin when a pimple is healed. Sometimes pitted skin or keloids remain for a long time, known as thick acne scars. Skin changes when acne becomes clear. The skin sometimes becomes darker or lighter than the real skin type. Conclusion: acne is a common disorder, but it can be effectively managed. Consult with a dermatologist for a specific treatment procedure. He will recommend a proper skincare package, including medicines and a skincare routine, which will improve the skin from acne appearance. Remember, patience is crucial in this case because the skin can be cleared even in months or years. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.